Hi everyone, Shannon DeCondo with NAMUS. I'm here to talk to you today about inpatient services with the 2021 documentation guidelines that's coming January 1st, 2023, and we hope you're ready. So specifically what I want to talk to you about today is as it relates to the middle column, our data. This is proven to be a problem with our office, which was our first rollout. And I can tell you, I think it's going to be a beast of a problem in the inpatient space because I specifically want to roll it down and talk about order and review, which I do think is going to be even a bigger beast of a problem in the inpatient space. So let's first talk about order. In the inpatient space, what we have that is unique to the office is standing orders. And that's specifically what I want to talk about in today's take. When we think about our orders in the inpatient space, specifically with hospitalists, we do have our standing orders. With standing orders, a lot of times what we find is they're not always in the documentation of today's encounter because they are standing orders. Now, that's going to be difficult when it comes to giving the hospitalist, let's say, credit for placing those orders. So that is something that you will have to figure out within your own organization. Maybe it's going to come down to asking our hospitalists to make sure they refer to those orders in the documentation of their encounter, or actually including those standing orders in their note, because they will not get credit for those orders if they're not housed somewhere or referred to in the documentation of their encounter. Secondly, let's move to, and by the way, we have a nice little decision tree that helps you on when to give credit for those orders, and we've provided that here for you. That hopefully will help you in making those decisions, whether it's inpatient, ED, nursing facility, no matter where you are, that decision tree should help. The next thing is talking about review. I think review is going to be the bigger problem. In the inpatient space, we have that auto import, just like we do in the office a lot of times, but in the inpatient space, it becomes a little bit bigger of a burden. We have all of these labs, whether old, new, impartial, relevant, not relevant, they get auto imported into the EMR, into today's encounter. And our providers often do refer to them. They review them with the patient, they review them themselves applicable to the note, and they want to get credit for them. Now, first of all, let's kind of review two different definitions according to AMA. AMA incorporated a new definition in the 2021 March technical corrections. And it was a term they added called analyzed. And the definition says analyzed is the process of using the data as part of the MDM. So that is actually, we are using the data as part of the MDM. And it goes on to say the data element itself may not be subject to analysis, but it is instead included in the thought process for diagnosis. So that is specifically when something is being analyzed. And then of course, we have our test and our review. The problem is also if you want to ever refer to page 6 of the new 2023 revisions of 2021 guidelines, it's very important to keep this page flagged, especially when dealing with our inpatient providers, because I'm going to specifically show you this. There in the bottom paragraph, I have it highlighted. It specifically says that ordering a test is included in the category of the test results, and the review of the test result is part of the encounter and not a subsequent encounter. So if the hospitalist on the day before ordered that test, then the hospitalist the next day, even if it's a different hospitalist, they're members of the same specialty, that hospitalist cannot get credit for reviewing those labs as part of the work of their encounter. So we have to be very careful in how we're analyzing the reviews inside the inpatient space. It's going to get a little crazy. That's also going to carry forward into nursing facility spaces, which can get a little sketchy there too as well. Emergency rooms, patients are typically in and out, so that's going to be a little bit easier. But these reviews are going to get difficult in the inpatient space. A better way to explain a review there would be the hospitalist ordered the labs and the cardiologist is coming in and reviewing those labs. That is a unique review of those labs and would certainly qualify as review. So again, we're going to provide more of these videos to help you as you're looking at how to apply the 2021 guidelines in these new types and place of service. And if you do need any help with training your providers, we're always here to help. We're providing all sorts of training right now for different providers in different settings, large health systems and small. So contact us if you need any help with that. But as for today, that's all I have for today's take. If you have any questions or comments, you know where to go. Have a great day, guys.